Heart attack or myocardial infarction is caused due to coronary artery blockage. Coronary arteries are the blood vessels which supply the heart with oxygen and nutrition. Over time, the inside of these arteries develop fibrofatty plaques of different sizes. These plaques are made of cholesterol and other substances floating through the bloodstream, such as inflammatory cells, proteins, and calcium. Many of the plaque deposits are hard on the outside and soft on the inside. The hard surface can crack or tear, exposing the soft, fatty inside. When this happens, platelets come to the area, and blood clots form around the plaque. The artery narrows further, and in turn there is less room for blood to flow through the arteries. Finally, this results in the occlusion of the coronary arteries, resulting in the death of the surrounding heart muscles. The patient experiences tightness, heaviness, or constriction in the chest.
Come in.
Miss Greta, how are you doing today?
I'm okay. How are you?
Good. Are you aware that you're being discharged today from the hospital?
Yes.
So the doctor has prescribed you a few drugs, and I would just like to go over them with you. But before I do that, I would like to make sure that you're not allergic to anything.
No.
You have not had a history of peptic ulcers or intracranial hemorrhages?
No.
Okay. So the first drug I'm going to go over with you is called Clopidogrel bisulfate, which is also known as Plavix.
Okay.
And here is your discharge papers,
Alrighty.
which I handed you upside down.
Okay.
But so the doctor wants you to take 75 milligrams by mouth daily with or without food. So that's kind of the good thing.
Okay. Why did he put me on this? Like, what is it supposed to do?
So Plavix is an antiplatelet drug, and it works by inhibiting enzyme ADP from binding to your platelet receptors.
Okay. What exactly does that mean?
Well, basically, it means that it's going to keep your blood from clotting. It's going to prevent it from clotting so that you don't have another heart attack or risk of a heart attack.
Okay, that makes sense. Are there any side effects that I need to be aware of?
So basically, the common side effects are flu-like, upper respiratory infection, headaches, or dizziness. So just be careful when you're sitting up and be conscious of when you're going to make an abrupt change in position.
Okay.
And call your doctor immediately if you experience bloody stools or urine, nosebleeds or any kind of excess bleeding, lots of bruising.
Oh, okay.
Because that means that we need to reassess and figure out why you're not clotting at all.
Okay. Is there any medications that I can't take while taking Plavix?
It's a good question. While taking Plavix, you really just need to be aware of any excess bleeding that might occur if you take aspirins, NSAIDs, or warfarin. So any other questions?
Nope, that's it. I think I'm good.
Okay, well, here you go, and then you can be on your way.